been struggling. I had emergency back surgery back in 2017. I had 4 herniated discs. They did a discectomy and laminectomy. And that was going good. And then a year and 4 months later, I was hit by a drunk driver. On the 4th of July, I was the DD. And ever since then, it's been going downhill. So I've been having like chronic pain in my lower back for about 2 years now, 2.5 years, going on 3 years. And then I slipped and fell. We had a snowstorm here in Ohio back in February. And I slipped twice. The first time I caught myself, the second time I went down, I still caught myself, but really like twerked my back. And I knew that I went to meet up with my mom that night, and I'm like, I have a feeling as soon as I get home, I'm not going to be able to walk. And I went home and was bedridden all weekend, and got up because I hadn't eaten anything. It was like a Sunday, and I got up and I hadn't eaten anything, so I ordered some takeout. Which until then, my front door was unlocked. Went and got the takeout from the front of the building, came back in, had a weird pop, and then in my lower back, and then my left leg started going crazy with like spasms. It felt like it was like drop foot and contracting like muscles and sciatica all in one. And I crawled to the living room, tried to get in a comfortable position, ended up calling 911. Had to crawl to the front door to let them in because I had locked the door. And went to the hospital. They actually told me that there's nothing that they could do for me. They gave me, I was like one of those patients. I've never been one of those patients in the hospital that was screaming at the top of my lungs for help because like I thought I was going to die. Like they gave me 2 doses of Dilaudid and then fentanyl, and it still didn't touch the pain. And so they actually sent me home because I met with my surgeon who did my surgery, and essentially all he says was, "You're too overweight. There's nothing we can do. Go lose some weight and come back and see me." And I'm like, I can't even walk to go to the bathroom. Like, and so then I contacted my family doctor. She sent me to Ohio State School of Medicine. It's like the hospital for our college here. And they sounded promising. They're like, "Yeah, you need a fusion. We're prepping you for surgery. We're waiting for a spot to open up on the schedule." Kept me in the hospital for 5 days. And then they're like, "Well, we're going to send you to a nursing home." And I'm like, "No, I'm just going to go home. If you're going to send me to a nursing home, I can lay there for free rather than paying a nursing home however much money per day." Right. And they're like, "Well, we want to set you up with our chief surgeon." Meet with the chief surgeon, and he's like, "Under no circumstances were we ever planning on doing surgery on you." And I'm like, he's like, "Essentially, you're too overweight, so go lose some weight." And he wants me to go get this spinal. He referred me to a pain management doctor who wants to do a spinal cord stimulator. Yep. And I've done my research on that, and that is not something that I'm wanting to do. So I looked you guys up, and you guys are what seems to be the only saving grace in the country.
Dr. Abbasi is amazing. I think you'll really like him.
Cool. So I'm to the point now, like I've been off work since February 19th. I can't even like sit at a desk. I'm sitting up now, but I'm on my pain medicine. I can't sit up for longer than like 30 to 40 minutes. Other than that, I'm in my bed, I'm on my couch. And pretty much all he has to say is, "Give me a date and we'll be in Minneapolis." So, yeah.
Yep. So the pain, I heard you say low back and left leg. Is it really down the front of the side or the back of the left leg?
The entire leg.
Entire leg?
Entire leg, all the way down to the toes.
Okay, and just the left side, does it ever go down the right side too?
Yeah, no, it doesn't ever go to the right side, which is crazy because my last back surgery, it was my right leg. But it's essentially, it feels like, and that's another thing too, like no doctor would acknowledge this, like it now feels like I have drop foot in both my feet. And I'm sure you know about drop foot, but that's terrifying. Like,
yeah,
it's like walking like this, like,
Yep, it's awful. And then, let's see, on a scale of 0 to 10, how would you rate your pain?
Inactive laying down, it comes and goes. Mm-hmm. Being active, it's beyond the 10. I mean, it's just, I have like matter of minutes. Like, I can't make it to my car barely. Once there, I'm okay. But like any kind of activity, like I can't even walk to a grocery store. I couldn't even imagine going into a grocery store right now. Okay. So.
Do you know approximately what your height and weight are?
6'3", and last I weighed myself was 495.
Perfect. And here. Any physical therapy, chiropractic therapy, or injections?
I've done injections in the past.
Okay.
Not recently for this visit, but we did five of them previously, and they did nothing.
Oh, sure. Where was that done at?
That was done because when I was in the car accident, I had a rehabilitation doctor. It was done through Dr. Robert Stevenson.
Okay.
Where was that from?
Here in Columbus.
And did you say you didn't get any relief from those?
No, in the beginning, like they kind of helped. So it was 2019. We started them in September of 2019, and then we did the last two in February 2020, and it was nothing at all. Like,
Kind of short term for those first ones, and then progressing into no relief.
yeah.
Okay. And then how about chiropractic therapy?
I have not been to a chiropractor. I'm terrified to death. Yeah.
So funny. And then physical therapy.
No physical therapy outside of the norm from what I did from the car accident. We did, I think, 12 weeks, which I originally went in. I had shoulder issues. The shoulder issues went away, but the back has just been progressively getting worse. So
when you did therapy, did you do it for shoulder and for back at all, or did they?
Yeah.
Good. Okay.
Yeah.
Twice
Shoulder.
for those 12 weeks then?
I'm sorry.
Did you go twice a week for those 12 weeks, or how many sessions did you do all together?
I believe it was twice a week for 12 weeks. It was a long time. I was working and in school and going to physical therapy on my lunch. It was a disaster. Yeah.
Was that in Ohio?
Yes. It was at crap. I can look it up and give it to you. I forget the name.
It's not a big deal.
Okay.
If Dr. Abbasi does order more therapy, where would you like to go for that?
Probably the same place that I went. They were really good.
I have to look it up.
Yeah. I'm trying to think. I know there's a Knight's Bridge.
Just a few more questions. Your imaging, do you know what it was? Was it MRI, CT, X-ray?
It was an MRI.
Okay.
Yeah, that was another thing too, like to lay on a table and like with pain meds it wouldn't even touch anything. And I had to stay in that position for 45 minutes. I thought I was gonna die. Like,
isn't that terrible?
I never knew the feeling, like when people say they're like, you go to that spot in your brain, like until I got the MRI, and they're like, all I could focus on was breathing and laying there. Like,
Yep.
I'm Dr. Abbasi. So tell me about what's bothering you. What's the problem?
my back sucks. Pretty much my lower back. I had emergency back surgery in 2017.
Tell me about it.
I had 4 herniated discs that they repaired. They did a discectomy and laminectomy. Everything was going good. And then about a year and 4 months later, I was hit by a drunk driver. And it's just been progressively getting bad ever since.
I see. I'm looking at your pictures. I see that they removed the back of the bone and they did a laminectomy and decompression. Is that about right?
Yeah, they told me laminectomy and discectomy. I'm not too sure what all those entail.
You know what levels? Did they tell you what levels?
They did not.
It seems to me that they did L3, 4, 5, and S1, mostly L3 to 5.
Oh, I guess that terminology does sound familiar. So,
okay. No, your pain. My assistant is telling me your pain is up to 10 of 10. Is that about right?
yeah, when I'm active, so like standing, doing anything like physical, like I've been off since February 19th. I'm in my bed and I'm on my couch. That's all I can do.
And the pain is going down the left leg only or both legs?
Just the left leg currently.
The pain that's going down the leg, that's very important information. Is it in the front of the thigh, side of the thigh, back of the thigh, or all three of it?
All of it. Yeah, it's my entire.
All of it.
Yeah.
Okay, makes sense. Now, this has been going on since when again? This pain?
Well, I fell twice in February.
Mm-hmm.
It's been getting progressively worse, but like the leg pain is new as of February. I fell twice. We had a really bad snowstorm.
Do you notice any weakness in your legs?
Yes, extreme weakness in my legs. Like,
okay. So let me show you what's going on, okay? And Unfortunately, lots of people have this kind of problem, and I explain to you what I see and what you should be doing for it. So let's start with this. Are you able to see what these your pictures?
Yeah. Yeah.
So this is the side view of your spine. This is up, this is down, this is front, this is back. The date of this surgery, let's see what it says. It's just recently, just about a month ago, so it's good enough.
Yeah.
This is bone disc, bone disc. Dark is the spinal cord, white is fluid, and the bottom 4 discs, the content of the disc is coming out, the disc is collapsing, and the material of the disc, look at that, they come and actually squeeze themselves out and push on the nerve in a significant way. And obviously that push on the nerve, that can literally, a disc is like a tire of a car that cushion the car against the road. It cushion 2 bones against each other. You have 4 flat tires in your back. And obviously the bone, grinding the bone, that can give you back pain. Then it push on the nerve that passing through, that can give you leg pain. So you're not a medical mystery. I see what the problem is. And he said, now guess what? In the surgery that you got, we literally removed the back of the bone to open up the space for the nerve. Imagine your spine is already weak. By us removing the bone, we are making it even weaker. But that's sometimes what we do. Okay, so it's a very common thing that, people who have what we call the herniated disc, we go there, remove the bone, and open up the space, and a few years later, symptoms get even worse. Unfortunately, this is a common problem, and the next time it happens, what we do is literally getting rid of the bad disc completely, and then stabilizing the spine by putting some metal in and making a brace inside, strengthening your spine inside so it doesn't fall apart. Okay?
Right.
So this surgery, open old-fashioned wear for 4 level, is a big surgery to start with. Now, if the patient gets bigger, and I apologize telling you, you're not a tiny person, that becomes exponentially dangerous because you have to go through more tissue. For that reason, most of my colleagues, if your BMI is above 40, they don't even recommend the surgery. Have you talked to any other surgeon locally?
Yeah, nobody will touch it. Nobody would do anything.
Yeah, I can imagine that. Nobody wants to touch it because you're big, and doing 4-level fusion is a big deal. For us, that's a routine things we do. Okay, because we don't cause all the damage on the way of going in. Now, having said that, we never jump to that. We do physical therapy and so on, but my assistant is telling me you did all of that. Is that about right?
Correct, yeah.
And practically, tell me exactly, what other surgeons tell you about what the solution is? Did they tell you just have to live in pain, or what did they tell you?
They pretty much said you're too fat, go lose weight.
Yeah.
And I'm like, I can't lose weight walking to the toilet. I can barely walk to the bathroom. Like, how do you expect me to lose weight? And they're like, well, figure it out and come back and see us then. And I'm like, okay, so I mean, it feels like a death sentence. Like,
yeah, I'm totally with you on that, and that's almost unhuman. How can you lose weight is a vicious circle. How can you lose weight if you cannot walk and do any activities? On the other side, the surgery is exponentially more dangerous if you have to go through more tissue, do that big surgery. Now, the only thing we are doing different, that we do that surgery through a small tube that doesn't require us to open everything up. So we are able to do, and we did a study actually that doesn't add much more to our surgery than if you were thinner. Literally, you can do almost the same safe surgery at the BMI of 25 or 45 or 50. Now, what is your BMI? Do you know that?
It was, I think 56 was 56? The last. Okay. I believe 56 or 58 sounds right.
So now, sometimes in the BMI of that range, I'm actually getting images is harder in the surgery, but I have enough experience. I feel comfortable doing that. Doesn't mean I can give you any guarantee or any kind of, that the surgery is risk-free. It is not. Every surgery has its own risk: bleeding, infection, coma, death, heart attack, and so on. Pulmonary embolism, and you have to push the nerve to the side. 50% of the time nerves are irritated. 85% people wake up and the leg pain is gone. That's the first thing people notice. And obviously, if you have a higher BMI, after the surgery activity you're putting more stress on those hardware. That's always a risk factor. Do you smoke?
Former smoker, but I haven't smoked in 5 years.
So you quit 5 years ago, you're telling me? Good. Okay.
Yeah.
So your surgery is an option, definitely. And it seems you have maximized conservative therapy. And I have the feeling my colleagues never questioned that you need a surgery. They just couldn't offer it to you safely. Is that about right?
Right. I just wish they would have been open and honest about that. Like they were never, it was just like, at the last minute, like, oh, you're too fat, bye, as I'm being discharged. Like, sorry, we can't help you,
Yeah.
You're the fourth surgeon I've spoke to.
So what did the other 3 surgeons tell you?
Just those things. One said, I wish that you would have had me before you had your first surgery. He said I would have operated on you, but he said now with your weight, I wouldn't touch you with a 10-foot pole. And then the other 2 are just you're too overweight.
So let me tell you, I can help you. Okay.
Say the word, give me a date, and I will be in Minneapolis.
So, I have to put you through a process, though. I'm very proud of my results, but my result comes from a very conscious and deliberate kind of protocol. Okay. No, but you do need the surgery. I will. No, we talked about the surgery. We talked about the risk of the surgery. Do you have any question?
No. I've done a lot of research on you. I admire your work, and I trust you. So.
But I need you to understand that it's still a process. Okay. I'll get the medical clearance. If you have no other medical problem, you're a good candidate. We will talk more when you come to Minneapolis. And the surgery usually takes, last time I did a surgery in your situation with your BMI, and I've done plenty of that. It took me about 2 hours, a little more than 2 hours. Even if your BMI was like 25 or 30, over an old-fashioned way, that would have been 5, 6, 7 hour surgery. Okay. I will pass you to my office, to my staff. They will help you and they work around your schedule. Now, I know that my schedule is pretty full, but I'll try to do my best to work around it to make it happen for you. But, just be patient. That's why they call me. Okay?
Okay.
My homework. Let me put all the right things together to make the surgery for you safer. Your situation is nothing out of ordinary. That people who are unfortunate in a situation like you, that in this vicious circle, they cannot move and they gain weight. And they gain weight and that put more pressure on the spine. And literally, we doctors, we want to do the safe things and we condemn them to lifelong of misery.
Right.
That's probably what you have been going through. You need to encourage those surgeons to just come and learn it the way that they don't have to massacre your back to get the job done. We can learn it. That's surgeon, they can learn it. But we surgeons get so busy, we don't want to take time off to do that. And your story that you said, how am I going to lose weight? I mean, that is a question for many people. And the fact that the 2 of them, they just look at you and just tell you go away, and the other one says, oh, I wish you would have come for the first surgery. That is more or less is an empty excuse. Okay, so the situation
I agree.
And I think we need to get the awareness out there that there is an option.
My mom has a question. She's right here. I don't know if she's allowed to be on the screen or not. She's sitting right beside.
Okay.
Hello, doctor. Nice to meet you.
Nice to meet you.
My concern is getting him there. He is like, do we drive? Should he fly?
No, fly. Don't drive. Driving all that way, all those bumps on the road is going to make him miserable. You fly, but just make sure you don't carry luggage or somebody else is with you. Somebody else have to be with you. Somebody have to take care of those luggage so you're not. I get patients from the entire United States all the time. Is the flying, obviously there's the takeoff and landing and so on, but driving is actually much worse. And we have what we call a concierge. We put you in our place. Every day you are here, my nurse will check on you. You're not the first person coming from a long way to get this care, because there are not many people who would offer you surgery in your situation. So I get lots of these people. We are prepared, and my office is there to help you with the details, okay?
Thank you.
Okay, great.
Thank you very much.
No, that's all I got.
Okay, well, thank you so much, okay? You have a good day now.
All right, you too. Thank you.